Welcome to Clear Answers About Clear Vision, the exclusive podcast series by Vance Thompson Vision. Our goal is to empower you with the knowledge and insights to make informed decisions about your eye care. Whether you're exploring options for vision correction, cataract surgery, myopia control, or oculoplastics, we're here to guide you. This podcast is dedicated to helping you achieve clear vision, one episode at a time.
Welcome, everybody. I'm Tanner Ferguson. I'm one of our refractive surgeon that works at our location in Sioux Falls, South Dakota, and our also location down in Sioux City. And I'm excited to be joined by two superstar optometrists. We have Nick Risbrudt, who's in Fargo, and John Goertz, who's in Omaha, and I'll let them each introduce themselves. So, Nick?
Yeah, Nick Risbrudt, here in Fargo, North Dakota. Just originally from Fergus Falls, a couple miles down the interstate. So happy to be often seeing patients from my hometown. And I'll have been here at Vance Thompson for 6 years in June.
John?
Yeah, my name is John Goertz. I'm in the Omaha clinic, originally from Central Kansas. Been involved with LASIK since the early 90s. And just kind of seeing all the advances that have come about over that period of time. So it's been exciting, and it continues to be exciting.
Yeah, it'll be great to have your perspective on this podcast so we can kind of talk about how much things have changed and how much technology has really allowed us to deliver better outcomes and better understand who's a good candidate for LASIK, when is a good idea to not do LASIK, and things like that. So I'll start by talking about some of our history and research and what's really helped, I think, shape who we are today and help shape LASIK as a whole for the field of refractive surgery. So our namesake, Vance Thompson, was fortunate to be involved early with refractive surgery. So back in the late 80s, early 90s, after he finished his fellowship with Dan Dury, another pioneer of refractive surgery, Vance was a co-investigator in the partially sighted eye study of PRK. And we'll talk a little bit more about the differences between PRK and LASIK later in the podcast. But that was a big deal as one of the, kind of early out of training, he was selected to be a co-investigator in that study, and that kind of catapulted his way into the world of research and refractive surgery. And then he eventually became a principal investigator in the PRK and PTK study, and was named the medical monitor of the PTK study that became the first FDA-approved use of the eczema laser. That's the laser we use to treat the cornea in LASIK and PRK. And then he went on to become a principal investigator in the first FDA-monitored trial of LASIK in 1994. And then that's really laid a foundation for research at VTV, and we have a strong research presence at all of our sites. And Vance went on to become a investigator in the first phakic IOL trial a year later after the LASIK study. And now we're heavily involved in all kinds of studies, even beyond refractive surgery. So it's pretty special what he achieved early and laid the foundation for all of us. And let's talk a little bit more about why, experience matters when it comes to LASIK. Maybe, John, you can speak on that.
Yeah, absolutely. I think, experience is something that deserves a little bit of a definition. And I think in refractive surgery, it's not only the experience of the surgeon, but it's the experience of the entire team. And so all the people that are involved from the point of testing eyes, make sure we get, the proper measurements, the ocular health exams beforehand, and then the experience of the surgical team. From a surgeon standpoint, again, it's not just the experience, but it's the training and having great mentors that can give you that 30 years experience in your training. And so I think that's something that we have to offer. All our surgeons have gone through a training program with primarily with Dr. Thompson, and have benefited from his vast experience in this area.
Mm-hmm. I know I enjoy working. One of the benefits of us growing to multiple sites is now we have a big team of experienced doctors who, like yourself and Nick, have seen different situations, because you can only simulate or learn so much when you're in training. but you can't simulate every, kind of nuance or instance you'll encounter when you're evaluating somebody for refractive surgery. And I think the evaluation is where experience really comes into play. Trying to understand, what is the best option to meet this patient's visual goals? Are they going to be happy with this option, or should we be thinking about something else? Or should we just continue with glasses or contact lenses? And I think that's where experience really comes into play. You have anything to add to that, Nick?
Yeah, I mean, what I enjoy is, a lot of refractive cases just aren't straightforward, and there's sometimes more than one way to accomplish the patient's goal, and sometimes we have to be realistic, and we can't always accomplish the patient's goal. But it's often, that I'm taking a patient case and I'm talking to the other doctors here, but I'm also forwarding that case to the over 20 doctors we have within our organization to get everyone's opinion. And I enjoy these sharing these cases and get everyone's opinion on what's the best way to accomplish this patient's goal. So relying heavily on my team here with Dr. Seth and Dr. Brooke and Dr. Greenwood, but also seeking opinions of you guys too on these threads that we share patient cases with.
Yeah, I think sometimes people want to think that, with the way technology's advanced, LASIK has become like a cookbook way of treating patients, when in reality it remains an art. Yeah. And it's really valuable to have experience and lean on others who have experience. So let's move on to talk about another thing that I think Vance Thompson Vision has been committed to since the onset, and that's technology. And technology has changed dramatically in refractive surgery. And we'll talk a little bit about how some of the advancements have changed the way we approach patients and how it's kind of helped outcomes. But John, maybe you can talk about how healing, the lasers have changed over time, and maybe how you've even changed your own practices.
Yeah, I think the cool thing about LASIK is the principle is basically the same as it always has been. And so, we create a flap of tissue, do laser corrections at the mid layers of the cornea, and then put the flap back. And the way we make the flap has changed dramatically over the years. We used to use keratomes, which were basically a blade to create a flap. And in experienced hands, they made wonderful flaps. But they can't compete with what a laser can do. And now we're using what are called femtosecond lasers to create these flaps that are just, almost perfect flaps of tissue. And which ultimately leads to a better result. The first lasers we used were what were called broad beam lasers. So they had a large beam that basically used the equivalent of a camera aperture that opened and created the shape of the laser ablations. The first lasers that I was involved with didn't even treat astigmatism. They would just treat nearsightedness. And so as time went on, we developed technology that took that big beam, and instead of using a broad beam, now use very small spots of laser that control heat things in the cornea and give you much more, or give you the ability to create these very specific shapes for laser ablation. So they're called small spot scanning lasers. Well, as part of that technology, we also had to develop eye tracking because these lasers use a small spot. Tracking little eye movements at the time of surgery has become very, very important. And so we've gone through many generations of eye tracking. Everything that we've changed with the lasers have made things just a little bit better, and we just get these incremental steps. But over the past 30 years, if we look at the initial outcomes compared to the outcomes we get today, there just really is very little comparison.
Yeah, it's pretty cool. I think I never was involved with the microkeratome days, but you still see that in some places. But I think we use the femtosecond laser at all of our sites to create the flap and then perform the treatment with the modern excimer laser. And now we even have different ablation patterns. There's sometimes people come in and they may not be a candidate for a traditional what we call wavefront optimized ablation pattern. So we do something that's called topography guided, and that kind of I think became popularized in the last five or 6 years. And that's in people who don't necessarily have a clear or well-defined astigmatism, And that's just one example about how, like, even beyond the laser we use, we have new ablation patterns that can help treat different patients that walk in through the door. Another thing where I think technology has evolved is in evaluation. And one thing we've used we've introduced at many of our sites in recent years is something called epithelial thickness mapping. And epithelial thickness mapping is a tool that essentially maps the outer surface of your cornea, called your epithelium. So it's about 50 microns, so quite thin layer, and your cornea has 5 layers. And there's some principles of epithelial modeling that I think help guide what you're seeing on the testing. But in general, I think it's helped us to better understand who's a good candidate for LASIK, PRK, or non-refractive surgery. Where I trained at, I worked with 2 refractive surgeons who are heavily involved in research on ectasia, which is a kind of a changes in your cornea after LASIK. It's an undesired complication of LASIK. And they had a big interest in epi mapping, and they did a study where they took 100 patients and they just looked at Penacam, or the traditional corneal topography, in 100 patients. And then they looked at the same thing, looked at the same 100 patients, but also used epi mapping. And in almost 20% of cases, the plan for refractive surgery changed. I think it was like 18 out of 100. And the benefit actually was that people I think 12% were ruled in for LASIK. So they were considered not to be a candidate on Penacam alone, but the epithelial mapping actually helped them rule in. And that's just one example of a tool that we've introduced that helps us better understand, like I said before, who is a good candidate for LASIK, who is a good candidate for PRK, and who's a good candidate to continue wearing glasses or do nothing. I don't know if you guys have anything to add to that, or any other technologies we've introduced in recent years that has helped you in your practice.
Yeah, I think, in the early days, we measured corneal thickness, and, we did a calculation and said, oh, you're a great candidate. Your corneas are nice and thick. What we've learned is that actually some of the patients that have had less than desirable outcomes have had very thick corneas. And so it's not just corneal thickness that comes into play, but it's kind of measuring or figuring out ways to know whether a patient has good collagen or not. And there's certain patients that have weak collagen that it doesn't matter how thick their corneas are, they're going to get in trouble. The opposite is true too. There's patients that have very normal corneas that just happen to be a little thinner, just like some people are a little shorter, and those patients do fine with surgery. And so not only has epi mapping helped us with that, but we have what's called tomography, which is the ability to look at the cornea in 3 dimensions. And we have some very, very strong databases that tell us normal from abnormal. And, the biggest disservice for us as eye doctors is to do surgery on somebody that should not have surgery. But it's also a disservice to not allow patients to enjoy the benefits of refractive surgery and tell them they're not a candidate when they're a good candidate. And so all these diagnostic instruments have just helped us on both sides of that issue.
Yeah, that's a great point. Let's talk a little bit about pricing. I think one thing that we are really feel strongly about is being transparent. And, the price that you see is the price that you'll pay. There's no hidden fees or aftercare fees or things like that. Maybe Nick, you can talk a little bit about our pricing and how we treat people who might need an enhancement.
Depending on the clinic you go to for your LASIK, pricing is kind of all over the board. And what you see is not always what you're going to end up paying. And at Vance Thompson, we have one fee that includes all consultations. There's no cost to the patient. All consultations are free. But our price for LASIK includes the surgery, of course. It includes all the medications patients need after their surgery, and it includes all the aftercare patients need after their surgery. I can think of maybe on one hand, 2 patients stick out to me that we needed to enhance over the last, I guess, 6 years since I've been here. And one was unique, pregnancy and things like that can affect someone's vision. And so I had a patient who had a little shift, and we just did a quick enhancement to get her back to where she wanted to be. I think our paperwork says our LASIK includes an enhancement up to 2 years. Other clinics will have a lifetime guarantee, and I think in medicine a lifetime guarantee can mean different things. But at Vance Thompson, we take care of our patients guarantee, and every patient's situation is unique. And at the end of the day, I don't always look at the time frame that the LASIK's been performed. I look at, what's best for our patient and what's going to give them the outcome that they want. So
Yeah, I think the theme there is, we're going to do what's right for the patient that's across from us in the room, and we remain committed to that. So we'll talk a little bit more about, Nick kind of talked a little bit about, or touched on, when you come in for LASIK or, interest in PRK refractive surgery, you get a free consultation. And it's pretty close to being the best eye exam you'll ever have, because we don't want to do surgery on somebody that we don't have a good comprehensive view of their eye health and and to make sure that we know how they'll do a surgery. So Nick, maybe you can walk us through what to expect during an evaluation when they come in for LASIK. Talk a little bit about the tests, like the things we haven't measured yet or talked about yet, to ensure that they're getting the best outcome.
Mm-hmm. Our patients for our, LASIK consultations go through a ton of testing before, the optometrist or ophthalmologist step in the door. And one comment I get quite often is, wow, I've never had so many pictures or scans taken of my eyes. You guys do a lot. And I tell them, well, if we're going to do this one time, we want to get it right. We're going to make sure we have all the accurate measurements we need. And, patients all often comment on, yes, the extensive workup, which can take a while, but also, man, I'm surrounded by the best team members here in Fargo. And I tell everyone I have the easy job of just getting to talk to the patient and build a relationship. And all the hard work is done really on the front end with that patient, with our technician. I'm so spoiled to have the team around me that I do. And they really get to set the stage, put the patient through all the pictures, all the scans, all the diagnostic images. And then I say, I get the fun part of just getting to have the conversation and choose what's best. And, just today, when you come in for a consult, the answer is going to be, yes, you're a candidate. Here's your options. The answer also might be, there's really no great technology that we can use to hit your goal. So for now, I would request or recommend that you keep wearing your glasses and contacts. And then oftentimes the answer is, we can do LASIK, not yet. And I just had a patient this morning who was really excited about LASIK. And I said, we can't do this yet. I'm going to initiate some dry eye therapies for you, get you into a better spot. And then we're going to do LASIK. And, to be honest, she wasn't thrilled with that answer because patients often come in and they're excited about LASIK and they've been thinking about it for a couple of years and maybe saving up the money for it. And then they come to the consultation and the doctor says, not yet. And so for this gal, we're going to treat some dry eye stuff, get her eyes a lot more comfortable. I'm going to repeat the measurements in a month. And I use the analogy, a good carpenter measures twice, cuts once. And we are doing that a lot, making sure we've got the most accurate measurements we can achieve to give the patients the best outcome. And like John said, yeah, in optometry school, the number one optometric oath is do no harm. And so our job is to pick the patients that are good candidates for refractive surgery. But ultimately, I think our criteria is probably a little bit more strict than most. And if we're not comfortable with the outcome, or we feel like we're pushing the limits of safety, well, we're comfortable telling the patients no at times. And I have to do that quite a bit. And sometimes the answer for their goal is maybe not a corneal refractive surgery, but a phakic lens or other technologies we have where we're often introducing another surgery to get them to where they want to be. But it all comes from all the testing they go through, all the images and diagnostic scans that we first interpret before we walk in the room. And it's a lot of testing, but it gives us the answers we need.
Yeah, I think in Jenna, we're shooting for a long-term play. I think we can do LASIK and get you in quick, but you may not see well in the long term if we rush through things. And to me, it's your eyes, and you get one pair of eyes, and I wouldn't rush through the process. And we're not here to rush you through the process. We're here to make sure that you have the best possible outcome and the best possible long-term outcome. And part of that is aftercare, because we do the surgery and then we make sure you're healing appropriately. And everybody can have, and I've kind of touched on this before, it's not cookbook. So sometimes the aftercare looks a little bit different for each patient. John, maybe you can talk about how, maybe somebody's aftercare is a little bit unique compared to another patient and why those reasons may be.
Yeah. And so, the majority of the time, patients go through the postoperative period having had LASIK very smooth. However, there can be little bumps in the road. Infection is incredibly rare, but it can occur. You can have a little bit of inflammation after surgery. We put you on a drop schedule, but that isn't necessarily what we do. We see a little inflammation, we'll increase the anti-inflammatory medications, and so we can do things like that. To keep you healing like you should. One of the things that does occur, and I think Nick talked about this some, is after LASIK, you do have a little drier eye for a period of time as the nerves are regenerating in the cornea. So the first thing you want to do is obviously treat it beforehand, so that you don't start from being behind the 8 ball. But afterwards, if you don't treat the dry eye, patients aren't happy. 2/3 of the refracting power of the eye is actually the air tear film interface, or the tear film. And so we do all these fancy laser ablations and measurements, and we get everything just as perfect as we can. But if you have a bad tear film, none of that matters. And so, we monitor those things very, very carefully. Enhancement wise, we talked about, honoring enhancements. I think one of the misnomers in LASIK is that enhancements are done because, you lose the effect of the treatment over time. The vast majority of enhancements are done because we don't get where we want to be to start with. And so, I think every surgeon, every doc has a little different sweet spot for enhancement. Mine's kind of 6 months for most patients, but you want to monitor those, and you want to see patients at 3 months and see what their correction is, and make sure it's stable over that period of time, so that you're not aiming at a moving target when you're doing that enhancement. We provide postoperative care here. But many of our patients drive from hours away, all over rural Midwest to have surgery with us. So we have a group of optometrists we work with out in the local communities. They all have our cell phone numbers. We're on the phone constantly with them, communicating about patients and little problems they're having or what. And so, most of these appointments are very rapid appointments. You see your local doctor. If they're not happy with what they see, or you're not happy with what you see after surgery, you're always welcome to come back and see us.
Yeah, I think as you kind of mentioned, issues with LASIK are very rare. But the issues that are, can occur are manageable, are usually manageable, temporary, and fixable. And that's why we like to see you after surgery, to make sure that we can, get you to where you want to be. Because we want you to feel good about the investment you made for your vision, and make sure you're getting a good return on that investment. So maybe we can share a couple patient success stories from each of us, or from a couple of us, talking about, how our commitment to technology and comprehensive eye care and follow-ups, and maybe a patient that stands out in your mind, Nick.
Yeah, I think last year I have a patient I'll remember for a while. It's a gal that worked in the medical industry. She's working in a hospital, and in hospitals, we know there's a lot of moving and dry air in hospitals. And so her biggest complaint was her eyes would dry out by about noon. She was wearing daily disposable contact lenses, but still having dry eyes with her contacts. So her goal for LASIK was to get rid of her contacts because they were making her eyes dry. So I made her stop wearing her contact lenses for a month, and then come back and see me. She wasn't too pleased with me for making her wear her glasses for a month, but I said, if you want to have LASIK, we have to follow this regimen. Came back a month later, her eyes were looking a little bit better, but you could tell looking at her that she'd been wearing contact lenses for the last 20 years. Initiated a couple more dry eye therapies, and I made this gal stay out of her glasses stay out of her contact lenses for 6 months. Initiated some eye drops to help her produce more tears to get these eyes lubricated. 9 months down the road, we were finally at a spot where we could do LASIK. Her eyes had never felt better. And from the time of the consultation till the time we did surgery, it was 9 months down the road. And it just goes to kind of what we say here is we always do the right thing and do no harm. Had we just done LASIK when she first walked in our door, she would have been pretty miserable for a very, very long time. because I say LASIK doesn't cause dryness, but if you do LASIK on a dry eye, that patient's going to be pretty unhappy for a very, very long time. So oftentimes we're telling patients yes or no or not yet. And for her, it took 9 months, and she was thrilled. One, her eyes had never looked better than they ever had, because she had red eyes her whole life. Her friends would comment on it. She was self-conscious about her red eyes. They were dry, stuck with these contacts. 9 months later, we finally got her in the right spot where we could do LASIK, and she was thrilled. So once again, it goes to show, do the right thing. And we'll often treat patients beforehand to get them into the right spot, to give them the best outcome with their LASIK or any of our other refractive surgeries.
Yeah, I think that's a very common scenario. Somebody who's a long-time contact lens wearer, they're starting not to be able to tolerate their contacts, probably because of dry eye. Then they come in for a refractive surgery evaluation. And those patients commonly have some dryness that we need to treat before surgery, which also usually includes being in glasses and out of their contacts for a while, which isn't the news they want to hear, but it is acting in the best interest of their eyes in the long term. And I think that's a pretty common scenario we see. I can think of a patient I saw last year who went to a couple different places, was told she wouldn't be a great candidate for LASIK. She just wasn't excited about the idea of PRK, so she came here for an additional opinion. And I did our comprehensive evaluation. And if you looked at her topography itself, she kind of had an irregular topography with that would be suggestive of maybe a risky to do LASIK. But we also performed epithelial thickness mapping and saw that this area that was producing this irregularity just represented some thickening, or what we call epithelial hypertrophy, on our epi mapping. And so based on that, we knew it wasn't a true, what we call asymmetric or inferior steepening that you want to not do LASIK on. And it was really the epithelial hypertrophy producing that pattern. And so we felt great about doing LASIK. And I think that's just an example of why it's really important to go somewhere that's committed to the advanced technology, and not only with the lasers they have, but the diagnostics that they use to evaluate for you for LASIK or refractive surgery. All right, well, I think we can wrap it up here. I think in summary, and you guys feel free to add, I think the reasons that come to us, I think, for refractive surgery is, as we've kind of laid out here, we got decades of experience. Our namesake helped, pioneer refractive surgery with early involvement in LASIK, PRK, and now that's kind of catapulted our involvement in research across refractive surgery and other parts of the eye. And we're always committed to, we remain committed to having the best technology. And we're here to do what's right or what's best for you and your visual goals.
Thank you for listening to Clear Answers About Clear Vision, the exclusive podcast by Vance Thompson Vision. We hope this episode has empowered you to take the next step toward achieving clear vision. If you found this information helpful, please share it with a friend who might benefit too. Ready to take the next step? Schedule an evaluation with our expert team or visit us online at vancethompsonvision.com to learn more. Together, we'll help you see the world more clearly, one decision at a time. Until next time, take care and keep your vision worth seeing.